Good morning. This is All India Radio, Kohima. The morning news read by Jonas Yentan. Centre has so far provided nearly 16.16 crore vaccine doses to states and union territories free of cost. Of this, total consumption including wastages is 15.10 crore doses. More than 1 crore COVID vaccine doses are still available with the states and union territories to be administered. The government said within the next days, states and union territories, in addition, will have received more than 20 lakh vaccine doses. Meanwhile, Nagaland has received 3,26,440 doses from the central government as on 29th of April. Total consumption including wastage in the state is 1,97,940 with 4.13% wastage reported, while 1,28,500 doses are available with the state. Nagaland Chief Minister Neiphiu said the state would need 16 lakh doses of vaccines for an estimated population of 8 lakh in the 18 to 44 age group. He said the total cost for the vaccine alone at the announced price for Covishield would be 64 crore rupees. Chief Minister Rio stated this in a letter to the President of Confederation of Indian Industry, CII, Uday Kotak, yesterday, requesting its member companies to contribute to Nagaland's endeavour to procure COVID-19 vaccines. He stated that procuring the said vaccines directly by the state government from the manufacturer would be a burden for the already stretched state's finances, as the state does not have any large company registered within its jurisdiction. He is approaching the CII president to request the member companies to contribute generously to Nagaland's endeavour to procure vaccines and provide these free to the residents of the state, the Chief Minister added. Nagaland has been recording a rise in coronavirus case of late. The state yesterday recorded 181 new COVID-19 cases, which took its caseload to 13,750. According to State Health Department, Dimapur registered 132 new cases, 42 in Kohima, 3 in Mogokchung, and 1 each from Kifre, Mon, Pek, and Dimapur districts. Among the new cases detected yesterday, 98 were from traced contacts, 78 cases were returnees, travellers, 4 from frontline workers and 1 armed force. The state also registered 29 COVID recoveries, of which 17 were from Kohima and 12 from Dimapur. Of the total 12,212 recovered cases, the active caseload in the state gradually increased to 1,072. So far, 90 COVID fatalities has been reported, while currently 1 death is under investigation. At present, the state has administered a total of 2,02,957, out of which 1,61,137 were inoculated with the first dose and 41,590 received the second dose. Prime Minister Narendra Modi will chair a cabinet meeting at 11 a.m. today over COVID-19 situation in the country. The Union Health Ministry has issued revised guidelines for home isolation of mild and asymptomatic COVID-19 cases. As per the guidelines, the patient who are clinically assigned to be mild or asymptomatic are recommended for home isolation. As per the guidelines for home isolation, the patient should be clinically assigned a mild or asymptomatic case by the treating medical officer, and such cases should have the requisite facility at their residence for self-isolation and for quarantining the family contacts. It also said that elderly patients aged more than 60 years and above and those with comorbid conditions shall only be allowed home isolation after proper evaluation by the treating medical officer. It said patients suffering from immune-compromised status like HIV, transplant recipients, and cancer therapy are not recommended for home isolation and shall only be allowed home isolation after proper evaluation by the treating medical officer. In a partial modification to Dimapur Deputy Commissioner's circular, there will be a total restriction of all movements from Chatter River Bridge, Batkai Bridge to Medzifema Town Junction from 7 a.m. on 1st May till 5 a.m. of 3rd May and from 7 a.m. on 8th May to 5 a.m. of 10th May. The restriction is necessitated to facilitate speedy completion of works and as a precautionary measure to prevent any injury, loss of life and damage to property. General public may take the alternative route from Dimapur Kohima and vice versa for light vehicles only via 7th Mile, New DC Office, Sukhoi Razape, Maikam Bimla Mainamsi, Muavam, News Sukunoma, Sirhi Angami, Sirhima SFS School Metsefemata. And as the number of COVID cases are on the rise again, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. With that, we come to the end of the morning news. Have a nice day.